The first partner I want to talk about, and I'm not being paid by them at all, is my experience with remote monitoring. So I used dental monitoring in my position working with an OSO. And when I started my practice, I started with dental monitoring because it's what I knew. And some of the enticement there is it seems like that they have some great AI tools that can be helpful for a practice. But pretty early on, I switched to Grin, and I would never go back. Initially, I switched to Grin because the cost didn't make sense for dental monitoring, but I'll tell you what I found, which is the real key to remote monitoring. As we transition, which I think all practices are going to, is to a better level of care with virtual or remote monitoring. The most important part is to keep a truly personal touch with your patients. And if you've watched a little bit, what has happened with dental monitoring is that now there are companies like Remote Response that are asking you to pay extra per patient to help monitor all those messages that come in or those notifications. Well, one of the great things about Grin is they have a couple different levels. So the entry level allows you and your patients to take scans, and then your practice can manage those scans and that messaging as you go along. But one of the things that I realized is at their HI or premium level, they provide you with a full-time employee who is trained to review each and every scan, to respond to those patients personally, and then to manage the messages as they come in. And as a startup practice, this is an incredible deal because you're getting a full-time employee that works 7 days a week from 7 a.m. to 7 p.m. monitoring and responding to those messages. And the greatest thing is it's personal. So my patients love it. Our employee that works for Grin, that works for us, is Renee. And patients are constantly responding to Renee, saying, have a great day, have a great weekend, thank you so much, you're incredible. That never happened with dental monitoring for me. Nobody responded because they all knew it was an AI bot. So that personal touch has been taken from a touch point of once every 2 months or something like that to weekly or every 2 weeks with our patients as she looks and has that personal touch with patients. That doesn't even mention the cost savings it's been for us. So as we've grown as a practice, Grin has grown with us, and we're getting a full-time employee for a fraction of a cost of what we could normally get. And so that's primary reason number one that Grin has been so fantastic for us as we have grown our practice with minimal footprint of our employees here in the office, and Grin has grown with us in that same regard. And even on our Google reviews, patients talk about that experience in that app. So if you're thinking about remote monitoring, I would highly recommend looking into Grin. And if you're worried about some of those AI tools, the only difference is Grin has many of those AI tools, but what happens is those tools go through the filter of your person who looks at each of the scans, gets the AI notifications for you before they get to you, and takes care of them from there. So as you're building a busy practice, having somebody that can do that for you, that is then trained to do it, and when they go on vacation, guess what? Somebody else from Grin steps in and monitors those same messages and does the same thing. Or if there's a new person, they train them, so it's not on you and your team to make that happen. Thanks.